thought I'd label my talk, so you want to be a surgeon, and I'm hoping the answer in the audience is a resounding yes from most of you. And if I go to the next slide, please. People might ask, why choose surgery? You're listening about lots of wonderful careers in medicine today, so if we go to the next slide, I would say that there are thousands of people in the audience, and I don't really know your motivation, but it may be that your family or friends have suffered from a condition that the surgeon has helped. Or perhaps, next slide, it might be that you want to save lives from an altruistic sort of point of view. Then again, it may be that you're really fascinated with anatomy. And I remember going to the library when I was at junior school, seeing a picture of the blood vessels in the lung, and I thought, this is amazing. But of course, you like anatomy, you may also like physiology. And that's just a, next slide please, that's just a fancy word for understanding how things work. So that might be your interest in surgery. Then again, another reason may be that you like the idea of being in the operating theatre. We've all seen television programmes where the cut and thrust of a theatre environment seems really exciting. And that leaves in the next thing. You might just want to get your hands on a power tool and get going. Now, I should have given you a warning. I know there's some young people in the audience. There are only 3 pictures. They're not gory, and this is the first one, so apologies. And that's somebody, if you can picture, the person's head is at the bottom of the picture and their feet are going up into the air. And that's somebody opening a chest, because to get to at the heart, you do need to get through the breastbone. Next slide, please. And of course, it may be the excitement, the thought of when you see these TV programmes, or you maybe visited a theatre, it might be the excitement of it. And if you go to the next slide. And it is an exciting career. It's highly competitive. It's challenging, not just through the training years, but actually when you're doing your job. I've been a consultant for 13 years, and still I find some bits of it challenging. And a lot of it, especially cardiac surgery, is time critical. If the heart-lung machine breaks, or if you have a massive blood loss, you've got 4 minutes before the patient is brain dead, and you do not want that. So you're always on your toes. And you're doing life-changing things, life-enhancing work, but literally life-saving as well. We are preventing, certainly in cardiac surgery, people dying of heart attacks or heart failure. But even if you're an orthopaedic surgeon, you're not even if you're an orthopaedic surgeon, you're saving years of pain if you give somebody a hip replacement. And of course, you get to use your hands. So manual dexterity, it's a practical subject, and it is really rewarding. The thank you cards mean so much. Or another motivation for you, next slide please, might be because you think it's a risky, macho, glamorous kind of field to be in. And my answer to that would be, next slide please, go and do something else, because surgery is definitely not for you. Next slide please. So what about cardiac surgery? Next slide. For me, I wasn't really interested in skin or soft tissue or breast surgery. Next slide. Muscles don't really do it for me either. Next slide, please. Bones, not for me. And next slide. The lungs, pretty important organs, but for me, next slide, it was the heart that really appealed to me. And so much of what we do, and language, you know, we talk about things being the heart of the matter, getting to the core, really sort of delving down. It's such an emotive subject, the heart. Next slide, please. But of course, showing you fancy pictures doesn't mean that people didn't know about the heart before. And this is a picture of a beautiful anatomical drawing by Leonardo da Vinci, who was enthralled by the beauty of the heart. Next slide, please. But it wasn't until the 1600s when William Harvey described the actual motion of the heart. Until then, everybody thought Galen had decided that the liver was actually the pump in the body, and the heart was just a passive, how wrong could it be, just a passive organ where blood was mixed in with oxygen from the lungs. But it was William Harvey who actually described the motion of the heart. And interestingly, it's a long quote, but you can see that he was so sort of taken with how complicated the heart function was that he thought that only God himself might understand it. Next slide, please. But of course, everyone's the first this and the first that. But was William Harvey really the first person to describe it? In fact, there was an Arab scholar, Ibn Nafis, who actually described that the heart was an active organ in the 1200s. So when someone's the first this, first that, you always read around a bit more widely. Next slide, please. Surgeries in the generality really took off in the 1800s and then later on with anaesthesia. And this is a picture of Billroth, who's considered the father of general surgery, and there he is in Vienna. And this portrait actually hangs in one of the art galleries in Vienna with all the sort of people watching while somebody's being held down, being operated on. He was a highly respected surgeon, but he said any surgeon who operates on the heart should lose the respect of his colleagues. Well, why would he say that? It was because any time anybody tried to touch the heart or do something to the heart, the patient died. Next slide, please. And this is the only science bit in the talk. And the reason was, as Harvey explained, it was such a complicated organ. You've got electrical activity at the bottom, which we see as the ECG, the green line on most of those TV programs on the monitor. You've got valves, 4 valves, opening and closing. When they close, they make a heart sound. There's blood leaving, and heart emptying, blood pressure generated. You can see, and this is happening dozens of times every minute in each heartbeat. All of these things are going on at the same time. So you can imagine it's a sensitive organ, and if you touch it, it either stops or it beats very fast, and in effect you've got no cardiac output. Next slide, please. So it was actually people, engineers and doctors working together, which is often how you find innovation happens, that people started to think, okay, if I touch the heart, it stops beating, patient dies. How can I touch the heart but still provide a blood pressure to the brain, the internal organs, your kidney, down to your big toes? And that's when they came up with a concept of the heart-lung machine. If you want to read a bit about it, BBC Futures had an article recently, and Gibbon was one of the founding fathers of this. So this is the bit of kit that, along with my team, that I can't do cardiac surgery without. And warning, there's another picture coming up. Next slide, please. And this is a typical sort of picture of open heart surgery and sort of progress. So again, it's like you're looking at the patient over the top from where the anaesthetist is taking care of the patient. So the head of the patient is at the bottom of the screen. The feet are going up into the air. And I can't point, but you can see there's 2 pipes. The one that's to the right-hand side of the screen is taking blood away, the blue blood that you draw in your biology lessons, out to the machine. The machine adds oxygen, does various things, and then you can see a pipe right at the bottom coming from the left-hand side of the screen, and that's the pipe bringing oxygenated blood back. And you can see that the yellow stuff in the middle is all the fat on the actual heart, and a little bit of pink is pink muscle. And for the keen-eyed amongst you, you can see a little sort of sausage thing running across between those 2 pipes, and that's actually a vein graft. So it allowed us to manipulate the heart, pick it up, move it around without upsetting the blood pressure of the rest of the body. That's all it does. It's a very important function. Next slide, please. So the standard joke is cardiac surgeons only do 2 types of operation. That's what I was told when I said I wanted to be a cardiac surgeon. But they are 2 very important operations. So the main bread and butter is coronary artery bypass surgery, where we literally bypass, with new veins or arteries, narrowed blood vessels. And we have 4 valves in the heart, and often 2 of those can get either narrowed or leaky. And you can imagine if it really is like being a plumber sometimes, but you can imagine if a valve is narrowed, blood doesn't pass through in the right direction and puts strain on the heart because it's having to push harder through a smaller hole. But you can also imagine if a valve is leaky, the poor heart is pushing blood forward only for it to come back again, equally straining it. So next slide, please. This is just a graphic of a typical setup of a coronary artery bypass grafting operation. Next slide, please. And this is actually how thin, this is an aortic valve, a specimen, and if you're looking at it, it's almost like a Mercedes-Benz sign. You're looking, you've chopped across the aorta and you're looking down into the heart, and you can see that these 3 leaflets are almost translucent. They're tissue paper thin, and when they open, they have a wide orifice for the blood to come through. But if you look at the next slide, this is a typical picture of somebody with aortic stenosis and narrowed valve. Now you can see the heart's below, we've chopped off the big pipe, the aorta leaving the heart, and you can see rather than three thin leaflets, this patient has two, and the blood is coming out through this tiny slit, so you can imagine why this poor heart is under strain and the patient would be breathless or prone to strokes or collapsing because there's just not any blood coming out. Next slide, please. But luckily, we can replace these valves, and these are a series of mechanical valves. We use the one at the bottom most commonly, a tilting disc valve. Next slide, please. And a lot of our patients are elderly, so we use either pig or cow-based tissue, so you don't need warfarin. Next slide, please. But of course, the people making the jokes aren't quite correct. There's lots of other things cardiac surgeons do in the operating theatre. You could go into transplantation, paediatric surgery, artificial heart surgery, minimally invasive, which is what is informally called keyhole surgery. And you're going to have a whole session later by Professor Shafi Ahmed on robotic surgery. And by the time you're consultants, there will be all sorts of innovations in virtual reality and artificial intelligence. Next slide, please. So that's a little whistle-stop tour of why I think you might be listening to this talk, and a little smidge about cardiac surgery. I really can't say it all in 15 minutes. So I thought I'd tell you a little bit about why I'm here. So next slide, please. I just wanted to say that I think I'm just a normal girl from South London. I was. My ambition was to go to Guy's Hospital, mainly because that was one of the only hospitals I'd heard of. I had heard of King's and George's as well. I ended up going to Oxford and not Guy's, and then I moved over to Cambridge to do my clinicals. And I was obsessed from one of those things in the list, but for personal reasons, I was obsessed with being a doctor from a very young age. I can't remember, although I think I had a brief flirtation with law at the age of 10 or so. It was very brief. And then again, for personal reasons, I was pretty obsessed with the heart. And a lot of my stuff at Oxford, I focused in on doing projects on the heart. But it was when I walked in to do my clinical training in the hospital in Addenbrooke's, and I walked into an operating theatre, it was almost like a eureka moment for me. I mean, some people, it takes time to understand what you want to do, whether in the surgical field or in the wider medicine. For me, I just thought, wow, I feel like I'm at home. So it was as naive or illogical as that. I like the heart, I quite like theatre, I'll be a cardiac surgeon. And luckily, the internet hadn't been invented quite then, so I didn't really know if it was tricky or not to get into. Next slide, please. And what I did at the time was a stepwise thing. You suddenly can't imagine, it was sort of, I knew I wanted to do it, but I had to plan a little bit of my way. So it was getting the right job, getting my exams, making sure I did, you don't need to do a high degree, but I did do some research, and I've sort of worked all across the units that I was really keen to attend. And so next slide, please. So eventually, actually 13 years ago this month, I was appointed consultant cardiac surgeon, and I was the one with both the amazing privilege of holding someone's heart in my hand, but also the real responsibility as well that comes with it. Next slide, please. But of course, as my husband always tells me, it's not all about me, it is about you guys. What about you? How are you going to make it? And what do you need to do? So next slide, please. I'm guessing we have a range of sixth form students and also early year medical students. So I guess I'm just guessing. I'm not in your shoes, but I would have thought with COVID and all the disruptions, people are probably concerned. Some of you are concerned about exams, getting into medical school, picking the right medical school. You pick it for all sorts of reasons. 30 years down the line, it probably doesn't really matter which medical school you went to. I quite like reminiscing. I went to Oxford and Cambridge. Is it that important? No. You might have financial concerns, and I really don't want to minimise those, because I would have been absolutely petrified of having to take out a loan. But be reassured that in the longer term, it will be it's a big daunting step, but it will be a good step in your future, in investing in your future, should I say. If you're at medical school, you might be wondering about passing finals, what specialty use, will I get a training job, will I ever get a consultant job? So these are all sorts of anxieties, and some of them are very similar to what I had, and I'll come back to that shortly. But next slide, please. My advice to you, next slide, would actually be have a bit of a plan, but don't forget I've had plans A, plans B, plan C. I once was doing a lecture and I said, and I never doubted I would become a cardiac surgeon. And my husband said to me afterwards, well, you know that time you were crying and you didn't want to go to work because it was all so terrible. So we all have moments and difficulties along our path, but gather information. I mean, knowledge is power. Find out. Maybe go to your if you're a sixth one, go to your local or write to your local medical student. I don't write email, I suppose. Attend virtual events. There's plenty of things for free. There are plenty of people who will try and charge you for information, but I would say that most people who attend these kinds of events are quite open and giving of their time. Obviously, just don't go and approach somebody if they've come out of a very long 12-hour operation. Make use of groups such as the Association of Surgeons in Training, who I'm sure are at this meeting. Google the Royal College of Surgeons of England. There are other Royal Colleges available. They have so much free information on their website. There's a careers page right from school children to medical students. If you're a medical student already, try and get some experience in the specialty and go and speak to people. But have a bit of a plan and try and get an idea to see if you have a feel for surgery and if you want to do it. Next slide, please. Next slide, please. Back one. I'm not saying that it's easy to do. You do need commitment, you do need passion, you do need to put the hours in, and you do need support. You know, you need support, whether that's from your family, friends, etc. So next slide, please. But your future is bright if you choose surgery. You're going to have better hours than we used to do. LTFT means less than full-time training, both for men and for women. People understand, people want families, you want to have a work-life balance, and there's a lot more team working, and surgery isn't a solo sport. Next slide, please. So my take-home message is that if you want to be a surgeon, good, because we need you. It's an amazing and rewarding career. You can do it, and I think I'm an example, one of many examples how you can do it. You might be any sort of box that you might think you're sitting in, and which means that you can't become a surgeon. I've been in that box, or I've ticked that box, and I have made it. You know, wasn't born with a silver spoon in my mouth. My father died when I was very young. My mother brought up 4 children. She was widowed at the age of 39. I was eligible for school meals. I have had some free school meals. So anything, and money was a concern when I went up to university, so I wasn't sort of lording it up in Oxford. I was living a fairly frugal but really fun life at university. So if you want to do it, you can, and I wish you all the best in your future career, and look forward to welcoming you into the surgical community. Thank you for your time and enjoy the rest of the conference.